As we navigate later life, our bodies change, and sometimes those changes can feel a bit concerning, especially when they touch upon something as personal as intimacy. It's a topic many feel awkward discussing, even with their doctor, but ignoring certain signals your body sends can be a painful mistake. Think of it like your body giving you a gentle nudge, or sometimes a not-so-gentle one, that something needs attention. There's a secret many men don't realize about erectile dysfunction, or ED as it's often called. It's not just about sex. It can be a crucial early warning system from your body about your overall health. Many men over 60 experience changes in this area, and while it can feel like a loss of youth or vitality, recognizing the early signs isn't about focusing on decline. It's about empowering yourself to address potential health issues head-on, often improving not just your intimate life, but your general well-being. In this video, we're going to look at 3 specific early signs of erectile dysfunction that urologists say you should never ignore. These aren't just nuisances. They can be indicators of underlying health conditions that are much easier to manage when caught early. Understanding these signs is the first step towards taking control and seeking the right help. It's about protecting your health and ensuring you can continue to live a full and vibrant life. There's a lot of misunderstanding and embarrassment surrounding ED, but let's clear the air and talk openly about what to look for and why it matters so much. Watch to the end for something that will surprise you. Let's start with the first sign that a urologist would tell you is really important not to brush aside. This is the change you might notice where achieving an erection becomes inconsistent. Maybe one day things are fine, you have no trouble, and everything works as it always has. But then, other times, in similar circumstances, it just doesn't happen, or it's much more difficult than before. It's not a total inability yet, but a noticeable variability where there wasn't much before. You might find yourself thinking, well, maybe I was just tired, or maybe it was just that one time. And it's true. Occasional difficulty can happen for many reasons like stress, fatigue, or even having a bit too much to drink. But when this inconsistency becomes a pattern, when those off times start happening more frequently, or when the situations where you can get an erection become less reliable, that's a signal worth paying attention to. What makes this an important early sign isn't just the impact on your intimate life, though that's significant, of course. It's what this inconsistency might be telling you about your underlying health. Erectile function is incredibly sensitive to the health of your blood vessels. An erection happens because blood flows into the penis and gets trapped there. For this to work properly, your blood vessels need to be healthy and flexible, and your blood flow needs to be unimpeded. Inconsistent erections can be one of the very first signs that there are changes happening in your vascular system. Think of it like a sensitive gauge for your circulatory health. Conditions like atherosclerosis, where plaque builds up in your arteries, often affects the smaller blood vessels first. The arteries supplying blood to the penis are quite small, making them particularly vulnerable to early changes in vascular health. So, if these smaller vessels aren't working as efficiently, you might experience difficulty getting or maintaining an erection some of the time, even if the larger vessels supplying your heart or brain aren't showing obvious signs of trouble yet. This is why urologists and cardiologists often say that ED can be an early warning sign for cardiovascular disease. It's like your body giving you a heads up that your blood vessels need a checkup before a more serious problem, like a heart attack or stroke, occurs. Ignoring this inconsistency and hoping it goes away is like ignoring the check engine light on your car because it only flickers on sometimes. It might seem minor, but it's pointing to something that needs investigation. It could be related to high blood pressure, high cholesterol, or the early stages of diabetes, all of which impact blood vessel health. These conditions are very common as we age, and catching them early, when ED might be the only noticeable symptom, provides a crucial window for intervention. Simple lifestyle changes, like improving your diet, increasing physical activity, losing weight, and managing stress, can have a significant positive impact on both your vascular health and erectile function. But these changes are often much more effective when implemented early, before conditions become more advanced. Medications might also be needed to manage blood pressure, cholesterol, or blood sugar. Having an open conversation with your doctor about this inconsistency isn't about confessing a problem, it's about initiating a proactive health check. It allows your doctor to screen for these underlying conditions. Sometimes the cause might be simpler, like a side effect of medication you're taking for another condition. Many common medications, including those for blood pressure or depression, can affect erectile function. Your doctor can review your medications and potentially suggest alternatives. Other times, psychological factors like stress, anxiety, or depression can contribute to inconsistent erections. These are also health issues that benefit greatly from being addressed. The key takeaway here is that inconsistent erections, especially if they persist or become more frequent, should not be dismissed as just a part of getting older or written off after one or two excuses. They are a sign that warrants medical attention to understand the root cause, which is often related to the health of your circulatory system or other treatable conditions. Addressing it early means you're not just trying to fix one symptom, you're taking steps to improve your overall health and potentially prevent more serious issues down the line. It's a proactive step that shows you're taking care of yourself, which is the most important thing you can do at any age. Now that we've discussed the importance of inconsistent erections as a potential early warning sign, let's move on to another closely related change that shouldn't be overlooked. Building on that first sign of inconsistency, the second early signal a urologist pays close attention to is a noticeable decrease in the firmness of erections. It's not necessarily about whether you can get one at all, but the quality of the erection when you do. You might find that erections aren't as rigid or as full as they used to be, making penetration difficult or impossible, or that they don't last long enough for satisfying sexual activity. This is different from complete inability. It's a change in the strength or sustainability of the erection. Just like with inconsistent erections, a decline in firmness is often directly linked to blood flow issues. For a firm erection, blood needs to rush into the penis under pressure and be held there. If the blood vessels are narrowed, stiffened, or not dilating properly, the blood flow might be insufficient to create full rigidity. Imagine trying to inflate a balloon with a slow leak. It won't get as firm or stay inflated as long. This decreased firmness is another strong indicator that your vascular health might not be optimal. Again, those small arteries supplying the penis are often the first place to show the effects of conditions like atherosclerosis, high blood pressure, or high cholesterol. When these conditions affect blood flow, one of the first places you might notice it is in erectile quality. It's a bit like the canaries in the coal mine analogy. The sensitive system for erectile function alerts you to potential dangers in your broader circulatory system before they impact less sensitive areas like your heart or brain significantly enough to cause symptoms like chest pain or difficulty speaking. For men over 60, this connection between ED and cardiovascular disease is particularly strong. Studies have shown that ED often precedes the diagnosis of heart disease by several years. So, experiencing decreased firmness isn't just a sexual health issue. It's a critical health message that you need to investigate the health of your heart and blood vessels. Ignoring it means potentially missing an opportunity to prevent a heart attack or stroke. Beyond vascular issues, decreased firmness can also be linked to hormonal changes. Testosterone levels naturally decline slightly with age, but significantly low testosterone can impact libido and erectile function. Your doctor can check your hormone levels with a simple blood test if this is suspected. Neurological issues can also play a role. Conditions like diabetes can damage the nerves that control erectile function over time, leading to decreased firmness and sensation. Certain medications, as mentioned before, can also contribute to reduced erection quality. It's crucial to understand that experiencing decreased firmness is not a moral failing or something to be ashamed of. It's a physiological symptom that requires investigation, just like a persistent cough or unexplained weight loss. Talking to your doctor about this allows them to perform the necessary tests to identify the cause. This could involve checking your blood pressure, cholesterol, blood sugar, for diabetes, and potentially hormone levels. Based on these results, they can recommend appropriate treatment. This might involve lifestyle changes, adjusting medications you're already taking, prescribing specific treatments for ED like oral medications, or addressing underlying conditions like high blood pressure or diabetes. Taking action when you notice decreased firmness can not only improve your intimate life, but also motivate you to make broader health changes that protect your heart and overall well-being. It reinforces the point that these early signs are opportunities, not just problems. By recognizing this change and seeking medical advice, you're taking proactive steps to ensure your health is on the right track. Don't let embarrassment stand in the way of addressing something that could have significant implications for your long-term health. It's a common issue for men as they age, and healthcare professionals are very used to discussing it. Next, let's talk about another very important early sign, one that often happens without even trying to have sex. Now, the third early sign that urologists strongly urge men not to overlook is the disappearance or significant reduction of spontaneous erections, particularly morning erections. For many men, experiencing an erection upon waking up is a normal part of the sleep cycle, linked to REM sleep. It's an involuntary physical process, not related to sexual thoughts or stimulation, and it's a good sign that the physical machinery for erections is working, specifically that blood flow to the penis during sleep is healthy and the nerves are functioning correctly. The absence of these morning erections, or if they become much less frequent or less firm than they used to be, can be a key indicator that something physical is interfering with erectile function. While psychological factors like stress or anxiety can sometimes inhibit erections during waking hours, they typically don't affect the involuntary erections that occur during sleep. Therefore, a decline in morning erections is often a stronger signal that the cause is more physical than psychological. It's another crucial pointer towards potential issues with blood flow or nerve function. Just like the inconsistency and decreased firmness we discussed, the loss of morning erections can be linked to the same underlying health conditions: cardiovascular disease, diabetes, high blood pressure, high cholesterol, and even some neurological conditions. If your blood vessels aren't delivering enough blood, or if the nerves that signal blood flow aren't working correctly, those spontaneous nighttime and morning erections will likely be affected. This sign is particularly telling because it bypasses the potential influence of performance anxiety or relationship issues that might affect erections during sexual activity. If the body isn't producing erections during sleep, when you're relaxed and not consciously trying, it suggests a fundamental physical barrier is present. Ignoring the loss of morning erections means potentially missing this early, clear physical indicator. Many men might not even think this is important or might attribute it simply to getting older. While some age-related changes are normal, a significant or complete loss of morning erections warrants investigation, especially if it's accompanied by any other difficulties with achieving or maintaining erections. It's not just about whether you plan to use that erection, it's a barometer for your body's physiological health. This sign, perhaps more than the others for some men, really highlights that ED is a health issue, not just a bedroom issue. It's your body communicating a potential problem in its plumbing or wiring system. Bringing this up with your doctor provides yet another opportunity to evaluate your overall health risk factors. Your doctor will likely ask about this specifically when discussing erectile function because of its significance in distinguishing between physical and psychological causes and its strong link to cardiovascular health. Don't feel embarrassed to mention it. It's a valid and important piece of information for your doctor to have. They can help determine if this is related to blood flow, nerve damage, hormonal imbalances, or potentially a side effect of medication. Addressing the underlying cause could involve lifestyle changes, managing chronic conditions more effectively, or specific treatments for ED. Taking note of the presence or absence of morning erections is a simple, non-invasive way to monitor your potential erectile health. A consistent lack of them should prompt a conversation with a healthcare professional. It empowers you to be proactive about your health, catching potential issues early when they are often most treatable and manageable. So, we've talked about these early indicators: inconsistency in achieving an erection, decreased firmness when you do, and the loss of those spontaneous morning erections. It's vital to understand that noticing these signs isn't a cause for panic, but rather an important invitation to take care of yourself. Erectile dysfunction is incredibly common as men get older, but that doesn't mean it's something you just have to accept and live with, especially since it can be a sign of other health issues. These 3 early signs are like a gentle tap on the shoulder from your body, urging you to pay attention to your cardiovascular health. Check for conditions like diabetes or high blood pressure, and generally look after your physical well-being. Ignoring them means missing the opportunity to potentially catch serious health problems early, when interventions are often most effective. The surprising thing I mentioned at the beginning is how treatable not only ED is, but often the underlying conditions causing it are. Modern medicine offers many effective treatments for ED itself, which can significantly improve quality of life and intimacy. But perhaps even more importantly, addressing the root cause. Whether it's managing blood pressure, lowering cholesterol, controlling blood sugar, or making lifestyle changes like quitting smoking, eating healthier, and exercising more, can dramatically improve your overall health and longevity, reducing your risk of heart attack, stroke, and other serious diseases. Think of ED as a health wake-up call. By listening to your body and talking to your doctor about these early signs, you're not just seeking help for one issue. You're embarking on a path to improve your entire health picture. It takes courage to discuss something so personal, but remember that healthcare professionals are there to help, and ED is a very common issue they deal with regularly. There's no need for embarrassment. Opening up about these signs is a sign of strength, of taking responsibility for your health and your future. Remember, small changes can make a big difference to your health and happiness. Don't hesitate to reach out to your doctor if you've noticed any of the signs we've discussed. It could be one of the most important conversations you have for your long-term well-being. Taking care of your health is the foundation for enjoying life to the fullest at any age. If you found this information helpful, please let us know your thoughts, or if you have any questions in the comments section below. We love hearing from you and building a supportive community. If you haven't already, please give this video a like, as it helps us reach more people who could benefit from this information. And be sure to subscribe to our channel and hit the notification bell so you don't miss out on future videos packed with tips and insights to help you live your best life at every age. Your health is your most valuable asset, and being proactive is the best way to protect it. Live your best life at every age.